piece of Swiss cheese to protect ourselves is to social distance and wash our hands. That's a very good strategy, but it doesn't accomplish everything we want. So you think a piece of Swiss cheese, it protects us some, but there's still holes. The second piece of Swiss cheese is wearing a mask. And so what that piece of Swiss cheese does is has less holes and it covers the other holes that aren't completely there. And it allows us to decrease our ability to get the virus and the ability of the virus to spread. The third piece of Swiss cheese, which has less holes, is the vaccine. And so if you put the vaccine on top of those two pieces of Swiss cheese, now you not only decrease the number of holes, you decrease the ability of the virus to spread. And so what this vaccine does is it increases our risk reduction. And so we're talking about preventative, yes, but it's more so a risk reduction on top of the things that we already have. And the important point also to remember is just because you get the vaccine does not mean that you cannot necessarily get infected with the virus. We're still looking at that information and we're thinking that it may decrease the spread, but people that get the vaccine still have to wear a mask, social distance, and do all the things that we said before. But this piece of information is going to be very important in order for us to push forward and deal with the pandemic.
Dr. Gath, it seems like the timeline of this vaccine has really concerned a lot of people. So we saw it go from research to the trials, then production, and now distribution. And a lot of people are very concerned and they're saying it's too fast and I don't trust it. Can you talk more about that and why you feel like it is safe for people?
So unfortunately, there's a lot of misinformation out there about the vaccine. The first thing is that it is true. We have moved very, very quickly, and science has moved very quickly in order to be able to get the vaccine to us. But the technology and the understanding of how to do this has been there for a long time. We just haven't needed to use it at this point in time for us to need a vaccine this quickly. Once the information was there that we needed this, and the companies got the vaccine or got the strategies to make the vaccine, the thing that moved it along very quickly that people don't really understand is money. When you're trying to do a major trial, it costs a lot of money. And so a company, when they get ready to do a trial, has to do a lot of things in order to be able to figure out the investment is worth it. What we had with this is that the investment was made by the government to say, we want this as quickly as you can do it, and we will get it paid for. And so there was not a money barrier, if you will, and we were able to get the study started very, very quickly. I can assure the community that the scientific rigor of the study, even though looks like it was very quick, was done in the scientific rigor of all these other studies that we've done in the past that may have been slower. And so I'm very comfortable in how the study was done. I'm very comfortable in how the information was accumulated and also interpreted. And I feel very strongly that the scientific rigor, even though it's very quickly, did not have any political implications. I'm very comfortable with the information that we have pushing forward that this vaccine is effective and safe.
All right, Dr. Gath, hopefully you're someone who's feeling uncertain but wants to get that vaccine. Dr. Land, I'd like to bring you into the conversation right now, because if you take a look at studies and you look about what people are saying about this vaccine, it seems like there is a very real distrust as far as medical science is concerned among many African Americans. And then if you take a look at that, and when we're talking to people in our community, this fear goes back all the way to the Tuskegee experiment, when African American men were injected with syphilis purposefully for decades. And so there's this fear that something like this could happen again, or that it's not safe. Can you address that and what perhaps can happen to change that distrust?
On mute. Can you hear me? Yes, wonderful. So I've been nodding my head listening to Dr. Gath, because I think he's really placed a nice summary on the work that has been done already, right? The vaccine is safe. Why are we so sure that this has worked? Tuskegee happened. It was a horrible tragedy for Afro-Americans, for the nation as a whole, for the research community. But what we learned from that ensured that we would have safeguards in place, that will never happen again. And so I have to give a nod to history and to our science community for looking at that and ensuring that that won't happen. And how do I know that? Well, we have institutional review boards. We also have independent agencies, data monitoring boards that look at the information. When we're doing research, when we're conducting research, the scientific community is held to a highest standard possible to ensure that that does not occur. So we're looking at the safety of our patients. We're looking at the privacy, we're looking at confidentiality, as well as the ethical purpose, the reason why we're doing this research. And so when we think about an institutional review board, we're not talking about one individual, we're talking about many. We're talking also about a diverse group of individuals with scientific background and a foundation and platform for doing what's right and ethical for all of us. So I really feel very comfortable that where we are today is not where we were during Tuskegee. That published report was 1978. We've come a long way since then, and there's a lot to learn. And my colleague, Dr. Boom, she's an immunization expert. And I also want her to make a comment about it because we've worked this and we understand where we need to go. And we're passionate about ensuring that families of all ethnicities are given due process, ethical research, informed decisions about participating in research. Dr. Boone.
Absolutely. Thank you, Dr. Lynn. It is imperative that everyone understands that the scientific community wants everyone to be safe during clinical research, but also when they're receiving medical care. And for that very reason, it was actually an outcropping from the Tuskegee experiment that there are institutional review boards. So you can't just say, I want to go, start this project or something like that. You actually have to take your idea, take it in front of one of these boards. It's made up of multiple people from all different scientific backgrounds, all different race, ethnicities, men, women, and they look at that to make sure that it is ethically based. It actually will help advance science to do something like that, and it will benefit the people who are participating. And they look at the risks and benefits of these things. So I feel very comfortable that the pharmaceutical companies actually had to go through these processes. And like Dr. Lynn mentioned, there are these external groups called data safety monitoring boards. And Pfizer had to have one of those, Moderna's had to have one of those. Those folks have nothing to do with the actual trial itself and really stand back from the sidelines and say, is everything going on here? What's supposed to be going on here? And they have to, the drug company has to check in every so often to make sure that all of it's safe. And so that in fact did happen. And then all that information is taken to a group like the FDA. And they've had specific groups set aside ready to work when they got this information. Because every day that we don't vaccinate against this horrific disease, more people are dying. And really that was why there's been a race to the cure, and this is a race to prevention.
And thank you so much for both addressing that. And I just want to say that I have noticed that Congresswoman Sheila Jackson Lee is now, I can see her video. We know that you're nearby at least. So Congresswoman, if you can hear me, I don't know if you can, or anyone who's with you, if you want to come over and wave whenever you would like us to address you, we are more than ready to chat with you whenever you are ready. But right now I want to get back to Dr. Lynn, and I want to ask you about how you're feeling about politics and this vaccine, because we have heard many African Americans say, and surveys show that they are very concerned that this could be a political stunt, that they feel like even maybe it was fast tracked to help some different politicians who are in office. Can you address that and how you feel like the timing of it all was as far as the election was concerned?
So I think this has to do more with the science community than politics. And Dr. Gaff, again, I love to be on this panel with my colleagues, right? So that you heard Dr. Gaff mention the speed, the rapidity of where we got to. This virus, the genomic sequence, was found in 1 week. That's phenomenal. That's rapid progress. That's not being pushed along. That's progress for us. That's technology. That's science at its best. And so the development of the vaccine took hundreds and thousands of folks involved, right? We had to look at what were we facing across the world. The amount of deaths, over 300,000 people are dead because we don't have a cure. The race to finding a solution was there, right? Development of a vaccine was of utmost importance. And so when you think about those clinical trials, that oversight was there. There were no corners cut, right? We had thousands of enrollees. We had disease at its highest level. And so all of that and engagement of private and public sectors came together so that we could get efficient, effective response to this virus.
If you happen to just be joining us, I want to make sure you understand what we're doing. And we are having a very candid conversation with this beautiful group of people who are doing everything they can to try to bring information to our African American community who is showing different signs of having higher numbers of it in their community, of high deaths. And the stats are really scary. So we're trying to bust some myths about the vaccine because there are so many rumors flying about it, and hopefully bring you valuable information that might make you just feel more comfortable about it all. So I'm Melissa Wilson, along with all of this panel. I want to make sure you know who we're talking about. We've got board certified infectious disease specialist, Dr. Joseph Gath, of the nonprofit Cure COVID Consortium. Also, you just heard from Dr. Michelle Lynn, pediatric emergency medicine physician at Texas Children's Hospital, also associate professor of pediatrics at Baylor College of Medicine, and also Dr. Julie Boom, the director of the Texas Children's Hospital Immunization Project. We're all able to do this because of our partnership with Fox 26 and a long-standing relationship with NAACP, the Houston branch. And so thank you for being here with us. Please give us your questions. We'd love to hear from you. Yes, Roger.
So that's a great segue. So I have a question, and so I'm going to just hop in right quick. And I'd like to either for Dr. Gath or Dr. Boom or Dr. Lynn. So when we talk about these trials, so obviously it takes a lot of volunteers to take the vaccine ahead of schedule. So does anyone understand or know kind of what the makeup was of some of these trials? And so to give us kind of a level. So, I've seen in the past where I saw in the news the other day where there was a mother-daughter team of African-Americans, mother and daughter. And so I think that might be some interest for us to know. It's like, okay, so if you have all these folks that are in the trial, what is the makeup? If anyone knows that, if not, then perhaps we can find that information. But I'd just like to put it out there to see if anyone knew what the makeup was of some of the folks in the trial.
I can jump out there and tell you there was in the Pfizer trial, there were 37,706 subjects in the trial. And unfortunately, the African-American representation was not as much as I would like. And that's a whole nother discussion about whether or not African-Americans participate in trials enough. And that's a discussion for another topic. But only 9% of the people in the Pfizer trial were African-Americans. Having said that, even though the number of percentage was small, because there were so many people in the study, you still had a fair number of African-Americans in the trial that were able to have participated. And we found in that African-American community that the efficacy rate was just as good as anyone else, and the side effect rate was no more than anyone else. And so while I would love to have had more people in the study that are African Americans and communities of color, I am comfortable with the numbers that are there, that I can tell our community that I feel that the vaccine is safe and effective for the African Americans in our community.
I would agree with Dr. Gaff on everything that he has said. We've looked at the information, and yes, for another day of discussion on participation by the Afro-American community.
And resolute. So I want to thank you for your leadership. The great House majority.
It is important to know that there were no discrepancies. I see Representative Sheila Jackson Lee on board. I think she may be ready to speak. Is that correct? Congresswoman?
Seems like she was there. We almost had her. We just had Maria on our chat here pop up with a question, and she would like for one of you to address the fact of what type of vaccine this is. And she was asking about, is it a live vaccine? And are you concerned about someone who has a compromised immune system taking this vaccine?
I think Dr. Boom would be the best person to answer that as a vaccine expert.
Yeah,
Dr. Boom?
I'm more than happy to take that question. So no, it is not a live vaccine. MMR and varicella are when they actually take the viruses and they weaken them. But when we give them to you, the virus, the weakened virus still replicates enough to give you an immune response, but to not make you sick. This is a very different technology where we're actually taking the genetic instructions for a tiny little piece of the coronavirus called the spike protein, and it just sticks right out. We're giving you the genetic instruction from that inside of a little tiny microscopic fat particle. And then that goes in your body, and then your body makes a little protein in your immune system, then it recognizes that and makes what are called B cells and T cells to have your immune response. So it is very different. It is not a problem if you are immunocompromised to be around someone that is vaccinated. So it is very important that if you are immunocompromised and you want to take the vaccine, you should absolutely go talk to your doctor first, and you should talk to them and make sure that this is the right step for you. We do certainly worry about immunocompromised persons getting COVID, the disease COVID from being out in the community. So so please, if that's your situation, please go talk to your doctor. Make sure it's the right thing for you.
We have such an important role to play in the direction.
Congresswoman, can you hear us?
In our history has played.
Yes, I can hear you.
A pivotal role and a critical
Hello, I'm so glad you're joining us. Do you have time to chat right now?
Thank you so very much. I've enjoyed this very.
Go right ahead.
Thank you. Thank you for hosting this. I've enjoyed this very powerful discussion. And I think the most important point I have to offer is I'm back on my way back to Washington. We're in the midst of the final hours of putting together a COVID-19 package that is going to be very important to our local community, particularly if we are able to succeed in securing the public funding for our cities that are going to run out of revenue on December 31st. And all of us have seen the people in line with food insecurity, even today. That legislation will include that. It will include additional monies for small businesses and our restaurants, and allow our cities to provide monies for our entertainment centers, but most of all, give more money for vaccines and give more money for testing. Many of you know, as chair of the COVID bipartisan task force in the United States House of Representatives, I have worked to continue to place testing sites, and I see that Dr. Gath is on working with any number of collaborators in our neighborhoods. And we have been able to increase the number of people who've gotten tested, which of course everybody knows helps to stop community spread. But today, as I listened to the discussion on the vaccine, I wanted to see for myself, and I started out at Lyndon Baines Johnson Hospital, LBJ, when the first box of vaccines, the Pfizer vaccine, was delivered. I was there and then did a walkthrough on how they would use that vaccine for 1,950 persons in the public hospital system, and that was at LBJ. And so we were able to see how the pharmacists worked, how the transfer of the vaccines at the UPS, by the way, this is just a little bit of color, had to make sure that they handed it directly to pharmacists, not to nurses, not to congresspeople, not to doctors. They had to hand it directly to the pharmacists who were in charge. And then as we went on, we went through the process of how individuals would get the vaccine. And I think this is very important because I've heard the question of transparency. And I think it is very important to make sure, I hope you can still hear me. I think it is very important, if you will, to let people know that besides the all-day hearing that was held at the Food and Drug Administration, transparency is how the individual person is treated. And when they come in, their information is put into a computer And then they are taken to have the vaccine, but they are given information as to what to do with the Pfizer because you have to come back in 3 weeks. They're given an app that they can check on any updates. And they also are given information or an app where they can get information. And if you want general information, you can go to fda.gov. In the afternoon, I went to Ben Taub to actually see vaccinations being done en masse. And when I say en masse, the employees lined up and they were lined up and they were enthusiastic. And one of the important points, I think, was seeing a wide diversity of individuals. That means there were Anglos, there were African-American, Asians, there were Hispanics, of course, and many, many others. We know that there will be no questions asked. It'll be immigrant and non-immigrant. We know that the vaccinations will be free. And so when we begin to do the general public, there may be mass vaccinations in large open space that we will utilize a group of contractors that have been trained. Right now, the hospitals are using their own staff. But I got to talk to those, Brianna, a nurse who was getting vaccinated, very happy, had been on the front lines, and certainly a doctor, a general surgeon who was getting it as well. And they were of different ethnic backgrounds. And so I think this is the most important point. When it comes my time, I'll be taking a public vaccination because the numbers in terms of doubt still exist among African Americans, Hispanics, and other populations. And what we need to do is to make sure that we share the information that you're giving tonight by medical professionals, but we as public servants need to also step up to let people know in different racial and ethnic backgrounds that I believe the vetting has not been subjected to political whims. Dr. Stephen Hahn, the FDA administrator, is formerly of MD Anderson. And I think the vetting and the research protocols and the clinicals have been strong. But let me finish by saying, I'm part of the advocacy for ensuring that more minorities are in clinicals. And I'm part of the advocacy to ensure that vulnerable populations are timely vaccinated so that we can have a mass of those vaccinated and we can begin to stop COVID-19 from that community spread. That is the key elements of what we're trying to do. This will take at least a year's process or certainly into the summer and maybe into the fall. But our commitment is that we'll have enough vaccine to vaccinate every American. And of course, in the first quarter, we'll be ordering another 100 million vaccines for our communities.
Congressman, thank you for taking your valuable time today to talk to us. It was an honor to talk to you a few months ago when you first started your campaign to help people with mental health issues during this, and you've done so much. So thank you for taking time to chat with us this evening. I want to hop back in with our doctors right now because we are getting some viewer questions. And one of those, Dr. Gath, you might be the person, or Dr. Lynn, anyone who would like to answer this one. And people who are just joining us are trying to figure out why we are focusing on our minority groups. What is happening with this and why this particular conversation? And can you address that and talk about why it's such a big concern in the African-American community?
Well, I think Dr. Gaff addressed it earlier, and open to hear him speak again. But we are a vulnerable population. We are at risk. Afro-Americans are dying from this disease at alarming rates, disproportionate to the general population. Minorities, those who are disenfranchised. And so it is important. It is of utmost importance for us to get the information out to communities so that we can start saving ourselves, our communities, our country from this disease. Mask wearing, hand washing, social distancing. That's what we have right this minute. We also have the vaccine that's here. We've done equitable distribution. Folks on the front line need to get it. I can tell you and echo what Congresswoman Sheila Jackson Lee said. My colleagues in emergency medicine, a diverse group of folks who are like, yes, please give me the vaccine now. All right, healthcare teams across the country are lining up to get the vaccine. we haven't lost sight of the entire population. And there's a distribution list that is online, the CDC, as well as the National Academy of Medicine, that you can see our ideas, the rigor that went into distribution. We want to leave no stone unturned, no family left behind in taking care of this disease. And as a community, we can't sit in the background. We need to be in the forefront. This is affecting our communities, and it's clear that it is.
Beautifully stated, Dr. Lynn. Thank you for stating that. Dr. Boone, this will probably be best for you. Albert on this chat is asking, why 2 doses of the vaccine? Why could they have come up with one where you just get 1 shot and you're finished?
So it's really common with vaccines or really any exposure that your body has to a new virus, that when you, on your first exposure, you make some bit of immune response. But then when we kind of re-challenge you, whether it's a month later or it's 6 months later, that then your body even makes a greater response. So the first time it builds a little army, and the second times it builds much, much larger size of army against any particular invader like a virus. And so that's why childhood vaccines, we give them at 2 months, 4 months, 6 months, and again in as early toddlerhood. And with this particular vaccine, we get that first dose, and that's sort of what we call like a priming dose. And then we give a booster, and that really gives us a full response. And it was with both of those doses for the Pfizer product. It's a dose at now and then a dose 3 weeks later. We found that it's so effective, 95% effective, which is really great for a vaccine.
All right, beautifully stated. All right, I want to go through some more science-based facts and stats and talk about how it's affecting our African American community, and that will better even address more of why we are having this candid conversation tonight. So according to the CDC, COVID-19 deaths among those under age 65 exceed their proportion of the US population. Researchers found that African American, Hispanic, Asian, and other non-white people account for more than 40% of COVID-19 deaths under the age of 65, even though they make up just 23% of the under 65 population. So African Americans account for nearly a third of deaths under the age of 65. White people under age 65 account for only 13% of COVID-19 deaths. Now, according to the Johns Hopkins Center for Health Equality, the overall COVID-19 death rate for African Americans is 70 per 100,000 people. The COVID-19 infection rate among African Americans is 62 per 100,000 people. Also, according to Johns Hopkins, the hospitalization rate among African Americans is 213 per 100,000 people. And again, hopefully hearing and learning about those stats will make us better understand why we're having this conversation tonight. Okay, so we have some more questions for our panelists now. I'd like to get through to those right now. So we know it's flu season, and usually this is a big concern, and now you're trying to deal with both of these. So a lot of people are wondering, okay, is there any risk in getting a COVID-19 vaccine with a flu shot? Do you have a suggestion about the timing of that? Maybe you just got your flu shot. Can you now get a COVID-19? Do you need to wait in between? If you haven't gotten either of them, which should you consider getting first? There's a lot of questions considering those two things.
So recommendations are that you wait at least 14 days between shots. So the flu shot, if you get the flu shot first, you'd need to wait at least 14 days before receiving the COVID vaccine.
And let me echo
All
that.
right, Dr. Lynn. Oh, go ahead, Dr. Gath.
Echo that also. Since the COVID vaccine is not quite here, this is the perfect opportunity to go get your flu shot yesterday and get that out of the way. So when your time comes to stand in line for the COVID-19 vaccine, you'll be able to get it then. Flu shot right now and get it done and get that over with and put it behind us. And then we don't have to worry about the timing of the COVID vaccine after that.
All right, you heard it right there from Dr. Gath. He says, get it done. Okay, Dr. Lynn, let's go back to you and talk about the side effects. This has been a big concern for a lot of people. Many people saying, you know what, I'm just going to wait and watch and see what happens to everybody else. But so far during the studies, it showed that there were pretty much just mild side effects for most people. And I believe that just the 2 cases overseas where people did have a serious reaction has a lot of people concerned. Can you address side effects?
Yeah, so as I've spoken to my infectious disease colleagues, one that you should expect is pain at the site. And that's common for most vaccines that you get, right? So that prick of the needle, as well as the after effect of that. So there may be some pain at the site. Is that a reason not to get it? No. We know that we can get through that, and it is minor. Fatigue could occur depending on how your reactions to that. Headaches, muscle pain, joint pain, and really rarely fever. Fever in approximately 14% of the research participants was reported. What's most important for all of that is that you stay in touch with your medical providers, right? And so, yes, getting the injection, mild reactions, concerns, questions about a reaction, direct those to your physician.
And then people are wondering, well, if I were to receive some of those symptoms, what is the best way to treat them? Is it more just like take some Tylenol or ibuprofen? How would you handle those?
Correct. Recommendations are for Tylenol or acetaminophen, whichever brand you choose, but also then speaking to your physician. So when you get the vaccine, because everyone who's listening will get it at some point, hopefully we'll sign up to get it. Most important is that transparency of information. So all of this that we're talking about, the mild effects, those will be gone over with your provider, informed decision on getting the vaccine, discussing, the pros and cons, where do I stand, risk versus benefit, but also then a contact information of, I'm feeling this side effect. I think it's fatigue. I think I've got more muscle aches than usual. What do I do? That safety net of speaking to your provider about it, that safety net of saying, okay, what's the best treatment for me at this point if I have my mild side effects? Really important.
May I add to?
And then we'll talk. Oh, go ahead.
No, may I add to what Dr. Lynn is saying?
Please.
With this, the side effect profile of this vaccine is such that more than likely you will have some mild side effects. And while we, as human beings want to feel good every day of our life, I certainly do. This may make you, as Dr. Lynn said, feel a little achy, joint aches, you may get a headache. And part of that is your body's immune response doing its job, doing its work. So actually, I want you to feel good about the fact that you're having a nice, vigorous immune response over the 24 to 48 hours after you get your shot, because that's how you're getting protection. And from the friends and family members that I've known who've had COVID, this is a walk in the park compared to what symptoms some of those folks have had, and certainly ending up in the hospital or in the ICU. So I would tell people, please expect some. That's the normal part of being a human being. Don't be afraid. CDC has also set up a program called V-Safe. It's lowercase v-safe. And after you get your shot, they will hand you a piece of paper and ask you to sign up for this. So CDC is trying to track individuals right after they get their shot, and they'll send you a text message and say, how are you feeling? How's it going? We want to know what symptoms you have, because they want to make sure they're capturing everybody's side effects afterwards so that we can really understand it. We've got a great idea of what that looks like from the almost 40,000 people in the trial, but we really want to have even a greater idea now that the vaccine is authorized under this EUA.
One of the questions we're hearing from our African American community is because, okay, we're telling them, and they've been hearing that their community is more vulnerable to getting it. They're more vulnerable to death from it. And they're thinking and asking us, well, does that make me more vulnerable to these side effects that you're talking about? Will I have them and experience them more seriously than others?
I don't think they're going to see any more side effects just because you're African American. It certainly wasn't seen in the studies. And just to add in to what the doctors have said, what is interesting with the side effect profile, the age over 55 had less of a set of side effects than the people below the age of 55. And so people that have more issues, if you will, actually had less of a set of side effects. And none of the side effects or in the Pfizer study were life threatening, and none of them required anything else other than perhaps a little Tylenol or that kind of thing. And so, again, as Dr. Boom has said, the risk of having COVID and having issues is up here. The risk of the vaccine is down here. And we're not going to have effective treatments for a virus, unfortunately. And so the big thing is prevention, prevention, prevention. And this is the key element to making sure that prevention helps in our community, it works in our community.
Absolutely.
And someone was just asking on the chat, they wanted to go back a little bit to those two serious cases we were talking about. And as I recall, it was a couple of people who had very serious anaphylactic reactions to other types of things. They carried an EpiPen everywhere they went, and they are now recovering from it. Can anyone address if you have severe allergic reactions to types of things, if you should be concerned in your community?
I'm happy to talk about that. So there were a couple of cases reported in the UK of people who had these history of allergic reactions and then got the Pfizer product and then had an allergic reaction. And so that very reason, actually, when the CDC Advisory Committee on Immunization Practice was actually discussing it and voting on it this weekend, they said that if you have an allergy to something, like you've gotten an injection before and you've had an allergic reaction to that, then you may be somebody who we need to kind of put you on the sidelines for a little while and have the rest of us get vaccinated. That does not apply to like foods you ingest. So if you have a peanut allergy or other kinds of environmental allergies, that's not what we're talking about here. So really, what they use the term, allergic to something injected in you. So that's really something medical that you would have been given in a hospital setting, generally, that you would have had an allergy to. And it will, again, be very rare for that to happen. So I do not think that that should be a general concern.
And we have someone on our panel right now asking about the contents of what is in this vaccine. And from what I saw, it was released today. So we're talking mRNA. That's the technology that everyone's really been talking about. And you've got everything from lipids to potassium chloride, sodium chloride, sucrose, some different ingredients like that. Can someone talk in general, Dr. Boom, since this is your specialty, you might want to talk more about what is in this vaccine?
Sure. So it's not uncommon that during the vaccine manufacturing process, that there are other components in a vaccine. Sometimes antibiotics have to be used so that the little vial that we have doesn't get infected. And there's other things that during the manufacture process, various chemicals that are added or come out. And so those will be listed on something called an excipient list. And so it's important to know with this particular vaccine, there's not things in it that you would think would cause an allergy or any problem like that. It's really this messenger RNA in this little fat particle. There is sucrose and polyethylene glycol and other things, but there's nothing really that is a concern at all that you need to be worried about.
All right, and Dr. Boom, Lynn and Gath, I want to ask all of you if you plan to get the vaccine, and do you plan to get everyone in your family vaccinated? How are you personally feeling about it?
I'm happy to take that. First, I am very, very proud that Texas Children started vaccinating earlier this afternoon. And I was very fortunate. We had a very specific framework where we really considered lots of different risk factors, your risk of getting infected, passing infection to others, your race, ethnicity, your age. And I am very lucky that I was one of those people who got to get vaccinated this afternoon. So it's right here on my arm. And I just feel like I've done my part to really help in this pandemic. And the light is shining at the end of the tunnel. And with each person that gets vaccinated, that light shines brighter and brighter. So I hope you guys would each join me when it's your turn to get a vaccine. Please take that vaccine, please. And please talk to your friends and family about the importance of being vaccinated so we can really bring this pandemic to an end and go back to a new normal life.
I am absolutely going to get the vaccine when my time comes. I'm waiting, standing in line at our place, and hopefully we'll get it within the next few days. But I believe in the science. I believe in the need. I believe in setting an example for our community of what we need to do, and I will do so. And I'll speak for my family. I'm going to strongly suggest they do it. Hopefully they're listening to this broadcast and we'll go ahead and sign up. But my family is also behind the importance and the need for vaccinations, and they will also participate when time comes.
I echo the sentiments of Dr. Boom and Dr. Gath. This is important. As an emergency medicine physician on the front line, my colleagues are there. Our families need it. We need it. We're fortunate to be in a facility, an organization, an institution that supports us and has been able to secure the vaccine. So Texas Children's, Baylor College of Medicine has been behind us, and we really, really appreciate that. I say thank you for myself as well as all of the medical teams. I may not be able to speak for all of them, but the opportunity is here. And we know that this is significant and a sea change for all of us.
I keep seeing questions come in, Yolanda. I know you just asked one about, should you still wear a mask after the vaccine? And I can tell you as a medical reporter, doctors right now are saying absolutely, because they don't know if you could still be a carrier with it in your nose or some other way. So, and then people won't know if you've had the vaccine. So you will need to continue to be careful once you get that vaccine. We are about to wrap up. Dr. Gath, I have one last question for you. And then we'll go over some resources, because I know you have so many more questions, and we could probably keep this conversation going all night, but I know you all have places to go. Dr. Gath, a lot of people are wondering if anybody in your African-American community was really involved in this vaccine. Did they help with the process? Do you know of any researchers or scientists who made a big difference in all of this?
So I'm going to give you a name that everybody should remember. Her name is Dr. Kismerkia Corbett. Kismerkia Corbett is in the lab of Dr. Antonio Fauci, and she's a senior virologist who led to the design of the Moderna vaccine. An African-American woman is the person that's going to be going in front of the FDA designing the Moderna vaccine. And so we have one of our own that's at the forefront and is bringing one of the vaccines toward us. At the FDA Advisory Committee, we have Dr. James Hildreth, who's the CEO of Meharry Medical College, that looked at all of the data and signed off on it. We have Dr. Antonio Fauci, a personal friend of mine that I've worked with for 30 years. He has nothing but the best interests of people in the United States and science, and he is also behind this. And so we have numerous people, and as we were talked about before, when Tuskegee was around, there wasn't anybody that looked like us there. Now we have people that are watching out for us, that have a seat at the table and have had a seat at the table with this vaccine research, that I know some personally, and I really feel like they're going to have our best interests at heart. So yes, we had participation on various levels on the vaccine manufacture, studies, and now with the rollout.
There we go. Incredible. And you know what? I would love to interview her. So Dr. Gath, if you have any insight on how to get a hold of her, I would love to know. Well, thank you, Dr. Gath, for your time. Dr. Lynn, Dr. Boom, an honor to have you with us. It's been great, Belinda and Roger, to work with you again and to raise this great awareness. And like I said, I know you have so many more questions, and I really wish we could answer all of them, but I want to make sure you know that there are a lot of resources, and hopefully maybe if you can either call one of these phone numbers, or maybe you can go to one of these websites, you will find exactly that answer you were looking for. So I'm going to go through these real quick, and then we'll wrap it up for you. So we've obviously got the NAACP Houston Branch. We're so proud of all they do for our community. So you can go to naacphouston.org. That's That phone number 713-526-3389. You also have the Cure COVID Consortium. That number is 1-800-558-1704. For that website, you just go to curecovidconsortium.org. You also have Baylor College of Medicine, bcm.edu/coronavirus is a website to go to. Texas Children's Hospital, just go to texaschildrens.org. You have the City of Houston Department of Health at houstontx.gov/health. Also, the Harris County Health Department at publichealth.harriscountytx.gov. So look at all those resources. They're local, they are helpful, they can make a big difference. Thank you for taking time to join us. We really hope that we've answered some of your questions. We hope we've opened your mind to the information. And again, all of this is science-based information. I would say it's been a lot more science-based than opinion, and I think sometimes that can help you make the decisions you need in life. So God bless you all. Take care of yourself. Be as healthy as you absolutely can. And we'll see you tomorrow morning on Fox 26 Morning News. Good night, everybody.
Thank you,
Good
Doctor.
night, everyone. Thank you.
Thanks, everybody, for joining. Thanks, Dr. Gath and Dr. Boom and Dr. Lynn. Thank you so much. And thank you, Congresswoman Sheila Jackson-Lee, for joining us.
My pleasure.
Thank you very much for having me.
Pleasure. Absolutely. Thank you.
Good
Stay
night.
safe, everyone.